Yo, thinking out loud, I must got about a quarter million on me right now. And they ain't talking about the Little Way record. I still the highest ceiling female escort for the record. And this is about $500 per day. Ain't gotta compete with a single skank. Hi HD Mafia, it's your girl Hazel Dior back with a hormone update video. How has HRT been working for me? You know, I'm 2.5 years into my journey now. It's a big blessing. I'm still in the beginning stages. A little bit shocked that it worked so well for me, and I'm going to kind of explain. I had a doctor's appointment with my endocrinologist, I'm going to say about 4 days ago. I actually recorded the whole visit. My phone was tripping and ended up freezing up, going up on my medication because, as you guys know, I was on 100 milligrams spirolactone and 0.2 milliliters of estradiol valerate per week. So it's been bumped up to 0.3 milliliters every week, which is, in my opinion, I feel like that's still very low. And now I'm taking 150 milligrams of spirolactone a day. So my recent levels that I have gotten back was through the roof. Everything was throwing off. Estrogen was way lower than what it's supposed to. Testosterone was way up here, like 300 and something. I was like, oh my gosh, you know. Back in February of this year, my levels was way up there again. So my levels haven't been right all year. How is your level so jacked up? Like, why? What's going on? I'm gonna say first, when I started, you guys know I went from the patch to pills for a little bit of time to the injections. So I've been on injections for quite a while now, about a year and a half. When I first started, my doctor had me on a super small dose, 0.5 milliliters every 2 weeks, and that clearly did not work for me because the medicine was out of my body by the first week, peak at like 7 days. After that, I started tweaking the medicine myself, starting creating my own remedies of, I'm not taking it every 2 weeks, I'm gonna take it every week, and I'm gonna take this much. And I feel like that started working for me. And I told the doctor about it. She agreed that that was a good regimen. I'm like, wow, a lot of these doctors, they still is getting caught up on information about us because they don't really know. So if it started working for you, then what happened? Even though that she always had me on a low dose. Even from me starting off on a patch, I feel like you usually start off on 2 milligrams, right? If you was to start hormones tomorrow, you would start off on at least 2 milligrams. I started off on like 1 milligram, very, very low. I gotten on pills 6 months in my transition. I took the pills for 3 months, it didn't do jack. 9 months, I got back onto the patch. She upped the dose on the patch in this time. So it was going pretty good. Now we up to a year. I'm like, okay, I heard a lot about the shots. I want to try the shots. The patch that I was on by the time the year mark came in was equal to 2 milligrams per day. If the starting dose is 2 milligrams, why is I'm still on 2 milligrams 1 year in? The patch worked really, really well. I would get back on a patch, but I would not get on that same dosage. You're going to give me about 2 of them, 2 or 3, okay? But they work really, really good. I would definitely recommend them. All of the methods works. Pills work. Take more than regular with the pills. And the patch, you just have to know your dosage. That's it. You have to have a good T blocker regimen, whether it's 100 or 200. And I started off on 25 milligrams of spirolactone, and I never heard of a dose prescribed that low for a trans woman, beginner or not. So I was on 25 milligrams for the first 3 months. Then I went up to 50. Then I went up to 75. Then I went up to 100 by the time the year mark came in. I just feel like I'm further behind than what I should be. Like, it worked wonders on me, clearly, right? I just still feel like I should be like even more ahead. Maybe that's in my mind, but I just feel like it because I'm like, I was on such baby dosage my whole transition, while these other bitches can get 1 milliliters a week, 2 weeks, and like, where is all my dosages? But it's okay because everyone is different, and I totally understand. So what I was getting at, the first 2 years of my transition, from start to 2 years, I was very consistent every day. January of this year came in, it changed because I went through hormone withdrawal earlier this year. If you guys remember me talking about that, she didn't prescribe me my hormones. It was a delay in all of that type of stuff. So I missed like a whole 6 weeks of my medicine at that time. So when I started taking my medicine again, started lacking even more, letting life problems get to me, stressing, feeling like the dosage that I was on wasn't enough, so I was skipping days. I'm supposed to take my blockers every day. I would take them like every 3 to 4 days. You're not supposed to miss dosages ever, okay? If you forget, it's okay. You can always just take it again, but don't keep messing it up every week. Stick to a plan. Because the more consistent you are with your medicine, the better your level's going to be. Feminine curves and the soft skin and all of that is going to come when you keep really consistent with your medicine. It's when you start being inconsistent, throw your body off. So, in my case right now, my body has been thrown out of whack because I've been so inconsistent this year. Took my medicine for like a month straight, and then after that month, then I'll mess up for like an entire week. And then the next week come, I may do good. Then the next week is messed up again. So my levels have been messed up. So that's why my levels is 300 and something for testosterone. That is male level. No trans woman level should be nowhere near that high. What have I noticed from my testosterone being so high? I noticed hair coming back very fast. I noticed erectile function coming back. Morning was, all of that was happening. And it was really putting so much pressure on me and making me so dysphoric because I'm like, OMG, I am on this little old dosage. I want a bigger dose. I don't know why I thought by skipping my medicine and just waiting for a bigger dose to come to save my life. No, don't ever do that, and that would never work. You always take your medicine. Always. Consistency is goals. You can never go left when you're consistent, okay? I preached a lot about staying on your hormones, being consistent, because I never thought that I would get to a point of my transition where I wasn't so excited about taking hormones like I used to. You know, that first 3, 6, even first year of you taking medicine, you're just so excited. And trust me, I'm still excited. Like, it's still surreal to me. Some days I drag like, oh my God, I gotta take this shot. Oh my God, I gotta take this pill. Like, hello, you signed up for this. You should be happy. You should never get to that point where you're not happy. And I heard about this with other trans women before I reached 2 years in, that they started missing dosages. And I'm like, how do you miss dosages? Like, shouldn't you remember? I totally understand. You get wrapped up in life, and if your transition is not exactly where you want it to be, you just started to stall. But stalling isn't going to make anything better. I'll be fine. I'm going to always take my medicine and become the best woman Hazel can be. That's for sure. Just know that. When is I'm getting orectomy? When is I'm going to get breast augmentation? When is you going to get your surgery, boo? We've been waiting. I know you guys have been waiting. I'm waiting too. I'm in the works of that right now currently. You know, I can go through the route of paying for it, or I can go through insurance. I'm going through insurance currently. I'm going to see a therapist currently. Right now. I already saw a therapist before I even started HRT. I saw her for about 3 to 4 sessions, and then she got pregnant and she was off the rosters for a while. So that was like over 2 years ago. So I know I just kind of found out of how the route to go. By me having a new doctor, the other day was my first time seeing her in person, and I had to go see her in person in order to get prescribed progesterone because she like I never even met her yet that she would want to know me better and it was going to delay. So I'm like, let me go ahead and see this therapist and see her a few times so that way she can be able to write me a letter, because my doctor, I can just about bet you that she wouldn't written no letter. And I think you need a letter. If I'm not mistaken, correct me if I'm wrong, y'all. But what I read, you need a letter from a therapist or a psychiatrist, and you need one from the doctor, or you just really need one from the therapist. So that's the route I'm going. It's a process. Trust me, I want my shit too. I want my motherfucking silicone or whatever they call it. I want my silicone breast. I do. I want my erectomy. I want that shit gone down there. Yes, I do. So it can start producing. I just don't stress myself out about it, talking about it all the time, because keep discussing it all the time and nothing's happening. It's just gonna create pressure for you. I actually have an appointment with her tomorrow. It's going to be my third session. Oh, I had to switch my insurance, you guys. Remember, I was telling you that the insurance that I was on didn't even do. I'm here in Michigan. I don't know where you guys from, but I'm here in Michigan, and things work a little differently here. But also, it can be the lack of resources that I know, because I know girls who live here in Michigan, not in the same city I do, that got all their stuff going on. Like, bitches just getting surgery left to right. And I'm like, what is I'm doing wrong? Nobody really tell you how to do this stuff. Nobody wasn't really telling me. Girls told me, oh yeah, insurance paid for it, but nobody really like told me how to go see the doctor. The doctor, they don't even know. I went through the doctor and asked her. I asked my last doctor. She didn't know. She referred me she referred me to the same place that I already go to and said that it's a pay-as-you-go plan. I'm talking about the insurance, because I don't have $5,000 just laying around. I have to hustle. You know how many months I gotta see to get that? Baby, unless I have a real good day. I am a hustling ass bitch, okay? But look, I don't have $5,000 to just grab and just go and get shit. I don't. I have to really work hard as fuck on top of shit that I already got going on. And I have a lot of faith, and I will give you guys more updates. I will let you guys know when I get my letter, all of that stuff. So that's where we at right now, where I'm seeing the therapist. Oh my god, my babies, I bought a new vacuum cleaner today. I'm so excited. I wanted a very powerful vacuum cleaner because the vacuum cleaners I have is not as powerful. It's like lackluster, and I need something that's gonna pick up the top layer, the bottom layer, and deep all the way in that carpet. I pulled so much dirt out that vacuum cleaner, it didn't make no sense. I said, oh. But here's a picture. It's so beautiful, yes. And I vacuum every day. I love to vacuum. Vacuuming is like a huge hobby of mine. I just love to vacuum. I will vacuum your house, honey. I will vacuum. I've been over many people's houses, and they was like cleaning up, and they haven't vacuumed, and I'm like, oh, let me vacuum because I can clean the out of some stuff. Baby, please, I am not nobody maid. I am monetized, you guys. I know y'all been seeing no mother commercials pop up, but do me a favor, my babes. Whether you are a trans man, trans woman, take your medicine, okay? I don't care if you feel like, oh, I look beautiful enough, I'm soft enough, I soften up enough, I harden up enough. Keep taking your medicine. I started being really dysphoric. You know, when you get so much praise in your transition, like people tell you you're beautiful, oh my god, I thought you was a cis woman. Especially like I go places, guys will approach me, and I'll just give them my number just to get them on my face. Or I would tell them later about like my services, and they were like, "Oh, I didn't even know you was a trans woman." I would gag every time they say that, because at that time I wasn't looking at myself like I was like, "Wow, I'm passing through like that." You know, sometimes you don't see it. Like, you guys may see it, but like I don't. So when I hear that, so I was hearing it so much, and pushing through so much, and I'm like, damn, I made it that far in my transition where I'm like, people don't even know. Not saying that you can't find out, don't get me wrong, but like, to the average eye, like, a woman, I started taking that to my head a little bit too much, to the point where I was looking at myself as a cis woman. Not that I forgot that I was who I am, I just started looking at myself as like a cis woman. That caused dysphoria for me, just because when it was days when I looked in the mirror and I seen a shadow, or I seen hair coming in, and I'm like, wait a minute, why is all this happening? And I'm like, bitch, you're a trans woman, you're still transitioning, you're not 10, 15, 20 years in your transition where everything is at its max. You know, like, no matter how much praise you get, you know you're beautiful, you know you are a woman. I don't let what others say to me and I take that to heart. I just like to, I feel however I feel by myself. Like, I know I'm beautiful, that's it. If you say I'm beautiful, that is more kudo points to me. But if you say I'm ugly, I'm not gonna take that and run with it. Like, whatever you say about me, it don't matter. That's why transitioning is really big, about you doing this for yourself. Because if you listen to other people, they'll run your whole transition. People can bring you up here, and people can bring you down here. The same people that say you're passable, you're beautiful, people can switch and they can say you're ugly, you're strong, you look like a man, you're a man, you a man at the end of the day. People can say that, and if you let praise get to you, you will let conflict get to you as well. So that's what I meant by that. I'm not transitioning for nobody, honey. Just be your own self. If you are a feminine male and you feel that that's who you are, be that. Because you're a little feminine, that doesn't mean that you have to transition. But I do know for a fact that there are labeled, identified gay men out there that really should be transitioning. They have a woman's spirit, and a lot of people is scared to live that out, because it is scary. It's way scarier than what some people may think. That once you transition and become yourself and start hormone therapy, and like, oh, it's easy from here. No, it's still not easy. You still have to boost yourself up every day. You still have to practice mental techniques to keep yourself afloat. I'm confident, but if I don't do stuff to work on my confidence, that confidence will be gone in a couple months. That's how real it is. You have to keep working on it. Keep working on yourself. Keep telling yourself you're beautiful. Know you're beautiful. Period. Become it. Like, for real. And be humble about it too. Because once you start getting cocky, what goes up will come down, okay? So people need to humble themselves. If you're very passable, don't shade any other trans women that may be 6 months in their transition or just starting, because you 5 years in your transition and you feel like you is mother. Because at the end of the day, it don't really matter if you look strong or if you look passable. Society, the ones that don't mess with us, they will look at us all the same. Nobody won't get no pass. Love yourself, accept what it is for the time being, and just grow into the bad bitch that you mother can be. And I motherfucking love you. And I will see you guys in the next video. Bye, babies. Love you.